Okay, today is Sunday, and it's September the 24th, 2021. My name is Jonathan Jones. I'll be your host and moderator for the afternoon. Alfreda Strong is my co-host, and she often will, on occasion, take the lead on this program as well. We certainly appreciate her valuable input and support. Many of you know her, but I'm the research director for the Healthcare Support Association of America, and we do this meeting in consort with Engage Global because Engage Global happens to be the manufacturer and supplier of one of the main products that we highly recommend and encourage many folks to use. Um, but the information provided here is for educational purposes only. Nothing that's being said here or presented is intended to be a replacement or substitute for a visit to your primary healthcare professional. In fact, we strongly recommend that you seek the competent medical advice of professionals that you trust. I discourage you from taking anything I say as a replacement for the statements that your doctor would say. So if your doctor told you to go left, I encourage you to ignore if I told you to go right. So we strongly encourage you to do that. If there is information that can be useful to you and adding it to the medical advice that you're being given by professionals that you trust, we recommend that. If there's something that we share with you that you'd like to have some of the resources or to know where the source material is coming from, just send me an email. I don't hide. You might be hard to catch up with me sometimes, but I don't hide, and I will eventually return your text messages or your emails. My email address is jonathan@hcsaaa.com. jonathan@hcsaaa.com. You can text me at 754-300-8909. 754-300-8909. So those numbers and that email address, feel free to use that. If you'd like specific suggestions as to maybe some nutritional supplements or dietary adjustments that you would like to make, just go to the website, hcsaaa.com, and fill out the form for support. It's free. We don't charge anything for what we do. The way that we get compensated for what we do, we're part of a network, and that's where we tie in with Engage Global. Engage Global is a multi-level marketing or direct sales company. So we do receive some financial compensation when we give suggestions or recommendations to the products that we recommend. But I can tell you that from personal experience that there's no bias, and we endeavor to be objective. If something that we have won't help you, I'll be happy to tell you that it won't help you. If there's something that you're better off going to the health food store and buying that will do a better job than something that we're suggesting, I'm the first one to tell you to do that. Because our goal is for you to be successful in meeting your health objectives, as opposed to our gaining any compensation for it. We're satisfied when people are getting good results. And we've seen thousands of people that benefit from some of the suggestions that we do. I'm a researcher. That's what I do. I just look things up. I read as much stuff as I can. I was driven by the fact that I watched my mother die. And my background is computer electronics and engineering. And I asked the intensive care nurse, what was she doing for my mom? And she said, well, we're monitoring her very closely. I said, well, I'm doing that. I mean, what are you actually doing to change what appears to be the inevitable? She looked at me seriously with deer in the headlight look. I mean, her eyes were big, and she just stared, and she looked me in the eye. And she said, to be honest with you, Jonathan, we're praying for her immune system to kick in. And that was like a punch in the gut for me, because I couldn't believe that, for $10,000, $15,000 a day in intensive care, that their best option for my mom was prayer. No, don't get me wrong. I'm a firm believer in the power of prayer, but I had that part covered. I had that under control. I figured that for what they were being paid for, that they were actually doing something more substantive. But my mother would not leave the hospital alive, because I felt like because I didn't have an immune system kicker in her, and neither did the hospital. So from that point on, I went through a total career change, and I'm no longer connected to computer electronics or engineering. My focus now is what changes outcome from chronic and degenerative disease. I decided I would never be in a situation where I was helpless again when someone that I cared about was in a hospital and they were being told that there's nothing else we can do. Now, since that time, I didn't keep count, but I can tell you that we probably have had maybe 100 or more cases of individuals who doctors pretty much had given up, and they were told that they had a very short time to live. I'll give you one example. One gentleman was told he had about 14 days to live. He had a form of cancer that they had never been able to fully diagnose. They didn't know what was really wrong with him, but his blood count was dropping. He and his wife approached me about 10 months prior to this and said, do you have any suggestions? I gave them a couple of suggestions. They said, we can't afford it. I said, okay, and tried to give them some suggestions as to ways that they could make it affordable, but they didn't want to take that route. That's in January of that year, probably about 7 years ago or so. Anyway, by September, October of that same year, the man's daughter called me up, or the son-in-law called me up and said that Pops was told that he has about 2 weeks to live. So I pulled him aside and I said, listen, here's the conversation that we had back in January. I think there is some natural things that will help him. And I said, but they said they couldn't afford it. And he couldn't believe his ears. I said, well, that's what they said. I'm just passing on to you. You'll never hear another word from me, but I know that there's something that would help. To make a long story short, the son-in-law and the daughter were determined to get, Dad started on the protocol. And not only did he not die in 2 weeks, he's still alive now. And it was probably 7 years or so ago. By the next year, they were celebrating their 50-year wedding anniversary from this unexplained, undiagnosed form of cancer. The doctor said to me personally, now this is not hearsay. The doctor said to me directly, this man's bone marrow will never produce healthy red blood cells. Those were his words. They will never produce healthy red blood cells. The only option he has is a full bone marrow transplant or blood transfusions first to get his body up to where he could take a bone marrow transplant, then a bone marrow transplant. Those are his only options. And so there we are. I think the body can heal itself given the right components. We've had other persons, one gentleman with esophageal cancer. He couldn't swallow anything thicker than water. Put him on a program, and within a week, he could swallow normally. 4 weeks later, doctors declared him cancer-free. Then they decided to make sure all the cancer was gone. They gave him radiation, destroyed his stomach, and killed him about 6 weeks later. That's what happened. I'm just relating the story. He called me up and said, do you have something that will help my stomach to repair itself? I said, why is your stomach a problem? Your esophagus is great. The doctors told you your cancer is gone. Why are you having a problem with your stomach? Did it spread there? He said, no, they gave me radiation. Why did they give you radiation? He said, well, Jonathan, they scared me. They said, and this is a direct story. Now, this is not hearsay. This was a conversation I had with this gentleman on the phone. He said they felt like they needed to do radiation to make sure it was all gone. I said, well, Richard, they told you they had to cut your esophagus out and move your stomach into your throat. They didn't have to do that. Why didn't you at least call and ask for a suggestion? He said, they scared me. And I almost said it. They've killed you now. And I was so sad. I mean, that one almost brought me to tears. Poor guy, he died. And but I could sit here and tell you stories for days and days and days and days, not because I'm special or not because I've done anything miraculous. It's only because there's information out there that we need to find and get access to. It's available. It's public information. It's not hidden or anything. It's available information. Just most of the time we don't have access to it. And I would dare say that it's unlikely that that your doctor, present company excluded, would not tell you about some of these things. They won't. My mother-in-law was another classic case. Her doctor, I have to say, did tell her that she, should contact someone else for help because there was nothing she could do for her. The doctor said, well, you have to find something at the health food store. So my mother-in-law and my sister-in-law said, well, what? You're the doctor. Tell us what to get from the health food store. And the doctor said, I don't know. And then her doctor said to her, doesn't your son-in-law have something that could help you? Talk to him. Can you believe that? I mean, that just blows your mind. And sure enough, I had left some stuff in the cabinet because she was ignoring me before. I left something in the cabinet. By the time I got the phone call, I told her to open up the cabinet over the computer, take some of that, and you'll get better. And sure enough, better outcomes. So anyway, now my mother-in-law is over, just turned 90 years old, and she had that conversation back when she was probably in her early 80s, and in terrible shape. Anyway, I digressed again. I apologize, because the stories can go on and on and on. So the question is, what can you do to improve your health? What we are in pandemic condition right now, and the note that I sent out said we'll give you some of the latest updates on Novavax. Not much news to say with Novavax. In fact, right now it does not appear as though Novavax is going to be available to us this year. So I'm just going to get that one out the way right off the bat. They're having some manufacturing problems that appear to be continuing. They have applied for approval in several countries, the World Health Organization and India, but and they still said that they're going to apply for emergency use here in the United States by the end of this year, but it's unlikely that the FDA is going to approve them because of their manufacturing issues. So Novavax may not be available to us until sometime late into 2022 for those who are interested in Novavax. If you're wondering what Novavax is, just go to my YouTube channel. We had a discussion about that a couple of weeks ago. It's youtube.com/Jonathan Jones. youtube.com/Jonathan Jones. Look on your screen and you can see the correct spelling of Jonathan Jones. Please don't put an extra H in my name. There's only one. My mother only put one H in my name. So, and no one else is allowed to add to or take away from therein. So youtube.com/Jonathan Jones, and you can just look around. There's some videos there that you may find of value to you. I make no apologies for the fact that those videos are unedited and long. You can jump around to wherever you want to in them. At some point, we will put markers in there so you can tell where the testimonials are. We'll at least tell you where the testimonials are in case you're looking for certain things, but we don't have the staff or the time to take care of that at this time. So, but we do intend to get some more volunteer help to assist with that. As far as results that some are getting by concentrating on their immune system during the pandemic, maybe let's talk about that before we go into it. We're just going to scratch the surface on the dental and the oral thing here in a moment. But I can tell you half a dozen stories about individuals that I've had personal direct contact with that have had good results by focusing on their immune system. One gentleman, fireman, first responder, his wife sent me a text message asking for information about a particular treatment that they were being recommended, monoclonal antibodies, and just wanted my opinion about it. And I gave my opinion. And I also added to that, but if you would like to try something else that could cause his immune system to kick in and fight back, I'll be happy to drop it off. And she said, absolutely. So I dropped it off. And 1 week later, he was fine. Symptoms were pretty much gone. A week after that, he was tested negative. These are positive tests. Him and the wife both tested positive. By at least 2 weeks later, their tests were negative after that. Another woman, a realtor who happens to own a jewelry store, she would definitely tested positive for COVID, very sick. Her doctor told her that he was not allowed to give her treatment because she was unvaccinated. Those were his words. That's what she said to me anyway. That I don't think she conjured it up, because it was a rare thing to even hear anything like that. And it wasn't even on the rumor mill that was the case, but she said that her doctor told her she was not allowed to prescribe medication until she was near death because she was unvaccinated. This is in Florida, by the way. I offered her something, hung it on her doorknob. And same thing, about 2 weeks later, she tested negative and she was feeling fine. She couldn't believe it. She says whatever that stuff is, it worked phenomenal. And in fact, in both those cases, by the way, what I hung on the doorknobs or threw on the porch as I was driving by for the firemen, because don't get me wrong, I believe that there's natural ways for the immune system to deal with anything, including a virus as serious as this one. But I still didn't want to get anywhere near them. I just threw it and took off. So, but it was microdaily in both cases, microdaily and Immunorx, the spray. Microdaily makes the immune system extremely strong and robust. Immunorx increases the intelligence of the immune system. It's a spray. You just spray it under the tongue, a 3 to 4 blast, as many as 3 times a day. If a person has full-blown AIDS, then they will go 3 blasts 4 times a day, and then 1 blast every hour on the hour during their waking hours if a person is severely immunocompromised. So it's an amazing product for making the immune system super intelligent. But that's what I gave to each individual. And 2 weeks later, that's what happened. So again, this is not a diagnosis. I'm not trying to tell you that microdaily and Immunorx will cure or treat COVID-19. I have no idea whether they went and got something else, if they were taking penicillin or horse parasite medication. I don't know what else they were doing. I just gave them that and told them to add this to whatever they were doing. And they said that they tested negative a couple of weeks later. So that's been over and over and over and over again. And in cases where individuals are trying to deal with maybe the side effects of one of the vaccines, that's when we recommend something called Vaxxed Rx, V-A-X-D, capital RX, all one word, Vaxxed Rx. We recommend that. You can find that at immunorxbio.com. If a person is considering one of the vaccines, the formulator of the product called it the antidote to the vaccine. So I don't call it that, but that's what he referred to it as. I just know that it helps the immune system to deal with, what may be potential side effects of any type of a vaccine. So it's on the website, and there's a coupon code that's still active, by the way, to get 50% off. The doctors are selling it for about $100 per bag of 20. But on the Immunorx Bio website, immunorxbio.com website, you can get a 50% off. So there's a coupon code there. So just take a look at it if you decide you want to add that to your regimen, or if you know someone that is looking to try to ameliorate the side effects. In all cases, microdaily should be part of the equation, and in no case should microdaily be eliminated as part of the conversation. I highly recommend that as the baseline. And by the way, highly, highly, highly recommend that if you're on the regular microdaily, that's the green one, the original one. I don't care whether you have a problem with the MTHFR gene or not. I highly recommend that everyone switch over to the methylated formula at the very least. Go to the methylated formula at the very least. What the difference between what the methylated formula does and the original formula is phenomenal, by the way. All the patents were taken on the original formula, but the methylated formula means that your body methylates B12 and the B9, which is the folate acid, properly. It's the difference between being in homocysteine and not. So if we stay in homocysteine, that means we're heading toward a heart attack. And the transition to being able to fully methylate B12s, your entire system is dependent upon B12. Everything about being alive is dependent upon B12, and you're being able to methylate it. It is no joke. It's very serious. Your entire central nervous system depends on B12 being methylated properly. Your heart depends on being able to methylate B12 properly. Your digestive system depends on being able to methylate B12 properly. Do not dismiss B12 as being insignificant, just another one of the Bs. It is not. It's a critical one. And the methylated formula of a microdaily is crucial to the equation. I'm surprised that I overlooked this for so long, to be quite honest with you guys, but I switched to it about a month ago now, and I can't believe that it was even possible for me to feel better than I was already feeling. But it took me up a notch. My wife, Joanna, even just today commented it She said, well, there must be something to that B12. She said, because normally I just want to go feel like I want to go crawl on the bed. Doesn't matter how much microdaily I was giving her. But since she's been on the methylated, whole new day. A whole new day. So switch. If you're on the original, go to that. If you're on the EMF, it's already got the methylated components in it. It's all right. You're fine with that. If you're taking hydro, I recommend that you add to the conversation the methylated formula. Okay, so how would you add it? First of all, depends on how much you're taking. Mix it is what I'm basically trying to get at. Take the hydro, but open up at least one capsule of the methylated and add it to the bottle and shake it up and drink it. So if you're doing one hydro 2 or 3 times a day, every time add in at least one of the methylated capsules. That's the purple bottle, okay? So that's the methylated formula. It used to be called MTHFR, but they listened to our suggestion. I said our group made some suggestions, and David and Melka listened. They changed the name of the original from microdaily with CoQ10 to microdaily original. They changed the name of the microdaily MTHFR to microdaily methylated. They changed the name of the that's the last one. I think the EMF was already EMF, so there was nothing else to adjust on that one. Okay, so the purple one is definitely by far the one to go with. Yes, Lydia Collins is sending a chat. That is the correct one, is the purple one. If you're on the green, go to the purple. Add the purple to whatever it is you're doing. The CBD too, by the way, is a powerful adjunct, great for anxiety and other issues. Now, as far as the dental and oral thing is concerned, Angelique Greer and we've been talking about this for a long time. We've known each other for many years, Angelique and her husband, James. But we recently got reconnected. They're up in Virginia area, someplace. Is that Virginia? Yeah, Virginia. And one of the first things she asked is, what are you doing about dental? I said, well, I hadn't had time to really focus much on that yet, but it's on the list of things that we were going to be focusing on. So we've been digging around and finding a lot of information about oral health. There's a book that you want to try to get your hands on. It's a free book. The doctor's name is Thomas, I believe. I'm just trying to find the title page here for you so you can see it. Highly recommend that everybody read it. I'm going to be going through excerpts of it over the next couple of weeks because it's so important. This book is the kind of book that I believe is going to change everybody's life. It's called The Hidden Epidemic. Now, that title was a documentary. That title was a documentary years ago that ran on PBS. It was connected to heart disease. So I don't know how he got away with calling his book The Hidden Epidemic, to be honest with you. I would have thought that the name was already taken. But anyway, there it is. And you see the subtitle is Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. Now, I'm not going to change the screen because I need to tell you a couple of my horror stories. In more than one instance of breast cancer had a negative outcome. Alfreda and I were working with one of her friends, and she had some crazy breast cancer. The doctors said it was a fungating cancer. I never even heard of anything like that. It didn't go well. We threw the kitchen sink at it. It didn't go well. Another breast cancer case. Dolores and I think we're working on one up in the Maryland, DC area. It didn't go well. We threw the kitchen sink at it, and it just didn't go. And case after case after case, and I'm just beating my head against the wall and trying to say to every doctor that I'm talking to, why is breast cancer so difficult to deal with? Why is it so hard? You can't tell me that the only solution is mastectomy and chemotherapy and radiation. That can't be the case. If it's an abnormal cell, what's going to make it normal? Yeah, I mean, how do we do it? If cancer can be impacted in other parts of the body, why can't it be impacted in the breast? Why is that killing women? And most of them found it to be somewhat elusive. Dr. Nkuzi is very effective with all kinds of cancers, but it's a little bit pricey. He gets paid well for what he does, put it to you that way. And for most people, the average person, having access to a Dr. Nakuzi is not possible, and it's not truly within their economic reach. So I've been looking for something that would be accessible to average people like us. So what can be done? The formulator of DNA 136 repeatedly has been saying to me that most breast cancers are really tooth infections. Dr. Nakuzi said the same thing. Most breast cancers are really tooth infections. And I'm staring at him and saying, you mean to tell me that, the medical system is performing highly invasive procedures on women, mastectomies, double mastectomies, when what they really have is a tooth problem? And I'm a little embarrassed to say that I'm kind of looking at Dr. Nakuzi sideways and saying, seriously? And even the formulator of DNA 136, I'm saying, seriously? We're talking about tooth infections here? And trace that back to a medical facility in West Palm Beach, Hippocrates, not a medical facility, a health institute, Hippocrates Health Institute. You can look them up. I can't remember the exact spelling of the name, Hippocrates, but look it up, Hippocrates Health Institute, and they're in West Palm Beach, Florida. During the search for what was going on with Joanda's immune system, we spent tens of thousands of dollars there at Hippocrates trying to figure out what was wrong with Joanda. And on the list of lectures that Brian Clemens is the founder of that institute. His wife's name is Anna Marie. Both of them are doctors. And they have medical doctors also that are part of their staff. One of the lectures that Brian gave was about tooth issues. One of his rules was never, ever, 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 ever get a root canal. Number one. Second rule was never, ever, 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 ever get an implant, was another one of his rules. I hear all this stuff, but remember, these are all things that are standard of care. If I ask for a show of hand right now, let's see, there's 32 people that we have in the room right now. How many have ever had one root canal? Just raise your hand, please. Just use the raise your hand on the electronic one so we can kind of get a count and see. And I want everybody to take a look at this. How many have ever had at least one root canal? So we're at 9 so far. We're up to 10. Okay, 11, 12, 13. So the number just keeps going up, 14. So statistically, if anyone has ever had a dental problem, we're at 15 now. So that's 50% of this group right here that has had at least the one root canal. Now, you know what that means? That means that you had an oral infection. And you're gonna see all this when you read this book, Hidden Epidemic. And what I'll do is I'll make a link to this available in the WhatsApp chat, so you can just download it because it's a free book. And they just released it a few weeks ago. So you can download it and read it for yourself. Statistically, that means that you had an oral infection. That was one that was symptomatic. You knew it was an oral infection because there was pain associated with it. There are many oral infections that are completely asymptomatic. No indication whatsoever that the infection is there, but guess what? Your lymphatic system is connected to our teeth. And that means that these infections have slowly been leaching bacteria and infection throughout the entire body. This man, this doctor, did I tell you the name of the doctor? I didn't tell you that, did I? It wasn't on the screen, was it? Hold on, let's see if we can see exactly his name. I think it's Thomas Levy, I believe. He's a cardiologist. Yeah, there it is. Thomas E. Levy, medical doctor. So his field of study is cardiology. And this guy decided that when you read his introduction, the preface is powerful. His introduction explaining how and why he wrote this book is simply going to just blow your mind. But he goes on, and now throughout this entire book, proves how most diseases are connected to poor oral health in some way. So as we take some time, we'll try to hit parts of it, in the future. Obviously, there's no way we could go through the entire thing now. Hold on, just let me get to the table of contents. I was reading portions of it this morning and thought we would take some time to even hit on some of those, but I don't think we'll have time because we're already at 40 minutes in now, because I don't know how to be short-winded. But here's chapter 1, the prevalence of undetected silent oral infections. Root canal treated teeth. And by the way, I'm working with a new product formulator out of St. Petersburg, who has formulated a product that is phenomenal for infection. It's patented for treating skin cancer, patented for dermatitis, all forms of dermatitis. But he's got dentists that use small amounts of it. It has such a powerful antiseptic properties that every time these dentists use it in their root canals, they never have recurrence of infection. And but that's not the case with other root canals that are being formed. Everything may be fine. You might be feeling good after your root canal, but there's 100% chance that there was still infection there, and it has an effect on your health and you don't even know it. So prevalence of undetected silent oral infections. Chapter 2, the pandemic incidence of chronic degenerative disease, the demonstrable link between oral infection and chronic disease. And look at what's on the list of what he's proved to be a connection between oral infection. He proves it to be, there's a connection between periodontitis and cancer, pancreatic cancer, breast cancer, colon cancer, head, neck, oral cancer, esophageal cancers, lung cancer, periodontitis and neurological psychiatric disease, Alzheimer's, Parkinson's, neurological and psychiatric associations and their comments. Periodontitis and all-cause mortality, periodontitis and other diseases and medical conditions, metabolic syndrome, hypertension. I hope we heard that. Hypertension, aka high blood pressure, direct connection between periodontitis, cerebrovascular disease, vascular disease, pulmonary disease, arthritis, and so on and so on. Chapter 4, increased oxidative stress. Now, we spent a lot of time here talking about oxidative stress. And one of our focal points is making sure that we have sufficient antioxidant capability in our bodies to deal with this. This man proves that there's a direct connection between poor oral health and elevated levels of oxidative stress in the body. So, short of getting the book, downloading the information, and sucking it all down, what can you do today? Here's what I recommend you do today. Today, write this down. Water pick, not the knockoff brand, the real water pick. Buy one on Amazon, okay? Not the little baby one, get the real one, okay? And all you need is just the water pick. You don't need all the extra fancy stuff. Just get that. Buy one on Amazon. Then find food grade peroxide. Food grade peroxide. Okay, find it. It's highly concentrated, so you don't want to mess with this stuff. It'll kill you. But get it. And all you need to do is fill a tank up in your water pick with that reservoir with warm water, because the cold water might be uncomfortable, but use warm water, right? Or at least lukewarm water, something that won't cause you to go crazy with cold water in your mouth. And then put about a dropper or two of that food grade peroxide in there. Do that every single night without fail. And brush your teeth twice a day, but do that water pick with that food grade peroxide in there every night. It will blow your mind how much lower your bacterial count is going to be. So your oral health will improve dramatically. So, and you'll also find it's going to probably have an impact on other things that you didn't even know you were still having a problem with. Okay, so that's just a freebie, but add that to it. And he also gives other recommendations too. There's a certain test that you can take if you can find a dentist that will do it, that will tell you where you have an infection. Asymptomatic. You have no pain, everything is fine, but there's some infection taking place there. So they can tell you that. Samantha asks, is this process of using the water pick, is that safe for kids, and the food grade peroxide? Now, mind you, when you do the water pick, now do the water pick properly. This is not something that you're going to spray in your mouth and go swallowing. That's not the case there. And I can't tell you anything about whether or not children can or can't do that. Read Dr. Levy's book, and maybe he's got a suggestion in there about that, but I can't comment on that. Maybe on the lower setting, you can do that. But I know personally, because I'm experimenting with this, by the way. So what I'm telling you is what I'm personally experimenting on. And I'm skipping my dentist appointments now for the next 6 months. I'm not recommending that you do that, but I want to see what happens. So I'm not going to my dentist. I've already seen a decrease in discomfort in areas that were sensitive. I'm noticing dramatic improvements already. I'm noticing that, you know how you get a little bit of bleeding sometimes? None. I'm having none of the bleeding gum issues at all. It's been 100% foolproof right now. But when you blast it with the water pick, you'll find out any trapped foods in the pockets will come out. So just because the way you do it is you spray it and you just let the water run out of your mouth into the sink. So do not swallow it. And of course you can rinse and all that. So, but follow the instructions carefully on the water pick, and do that, and you'll find that you're going to see some amazing results, in my personal opinion, based off what this gentleman is saying. Everything that we're doing to try to feel better, everything we're doing with MicroDaily is a big, 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 big plus. But we have no idea how we are reinfecting ourselves over and over and over again with our own mouth. It's a terrible thing. Okay, going to pause now and shift gears. For those who are new here with us, if you're trying to get your hands on MicroDaily, just get back with the person who invited you, and they will help you set up an account. Now, I already told you which one I recommend. It's only $59.95 to get the methylated form of MicroDaily. $59.95. Get it on subscription. Don't go into that whole, well, I'll just buy it from you when I need it. Get a subscription, because what I find with any of my customers who depend on me to get them MicroDaily, they will always find themselves running out and being without it for like a day or two, a week or two sometimes, because I can't keep it on the shelf. We can't keep it. No matter how much of it we buy, we can't seem to keep it on hand. So your best option is to make sure that you have a direct relationship with the manufacturer, Engage Global. So I forget the name of the guest invited by Mamie. Nesbitt, talk to Mamie. She can help you get your own wholesale account. And the other guest that was invited by Dolores, same thing. Just get with them. So anyone who's a guest here for the first time, whoever invited you, just get back with them and they'll help you set up your own wholesale account. How much should you take? Well, if you're over 40, then we need a little extra. So I was trying to take 2 twice a day, which is what Dr. Prasad recommends. But I found that I had to increase my dose to 4 capsules twice a day. When I did that, I noticed a dramatic difference in how I felt. I was actually a little bit surprised. I thought that I was doing pretty good, but was wondering why I was dragging a little bit late in the day. And so now I take 4 in the morning with food now. Make sure you do it with food, because some of the components in MicroDaily are oil soluble. So that means you need a little bit of food to make sure that they break down properly. But I take the 4 in the morning, and then at midday I take 1 hydro. So I actually bump it up a little bit because I want the extra glutathione in my body. Things are killing us right now, folks. Every single day, what we eat, what we drink, and the air that we're breathing is introducing free radicals into our body. It's a constant battle. So you are now going to start reducing that free radical load and oxidative stress by improving your oral health. So you're going to be doing that. But in the meantime, there's still we're being bombarded by free radicals. So that's why we need a little bit extra. Keep your water intake high. Half your body weight in ounces of water. So this again for the new ones that are here. Drink half your body weight in ounces. So if you weigh 190 pounds, right? That's what I weigh. You need 85 ounces of water per day. more or less, right? So whatever your weight is, if you are a 200-pound person, you need 100 ounces of water, just for the sake of easy math, okay? So that's how much water you need every single day. Not, well, I drink plenty of water. Please don't do that. Figure out how much water you need and make sure you're drinking the correct amount of water, because too much water is just as bad as not enough. So you don't want to overdo it either. So just make sure you're on the right par. If you are a coffee drinker, that's a deficit. That does not replace the water. So if you drank 2 cups of coffee and they were 8 ounces each, you are now 16 ounces in the hole. Okay, so whatever your number was, add 16 more ounces of water to that, because the caffeine is actually dehydrating your body. So you're at a deficit. So get the right amount of water in. Tea counts. So if you drink tea, that's okay. That's water, especially green tea. Green tea is one of the healthiest forms of stimulant that you can drink. It's a good thing to have. Okay. Detox. Be aware that you could detox. We've actually had people that say, oh, well, I got this happened to me or that happened to me, and it's never happened to me before. Therefore, that stuff, that vitamin is no good. Oh, yes, it is good, because if something happened to you, it's better that it happened that way. If it's nausea, if it's a headache, if it's a gastrointestinal issue, whatever it is, it needed to happen, because that means that you were a ticking time bomb. So you need to go through the process. That's called detox. So it's almost like renovating a house. You cannot go from a wood frame house to a beautiful palatial house without tearing something down. There's going to be some demolition involved. And that's what detox is. It's like demolition in the body. You're breaking down bad stuff, and eventually your body will rebuild and replace it with good stuff. Now, for those of you who are having gastrointestinal problems, besides switching to the methylated formula, I highly recommend that you take a look at Immunorx Powder. It's the highest quality of bovine colostrum we have ever been able to find. And it's on the same website, immunorxbio.com. Highly, highly, highly recommended. Just 1 tablespoon before each meal, and it'll change your life. So if you're dealing with things like constipation or diarrhea, either way, whatever level of gastrointestinal problem you have, at least 1 tablespoon before every meal, it'll change your whole life. Okay? So let's pause and see if there's any questions. And if you have a personal story that you'd like to share, please share it, because it's the stories that actually keep folks coming back to our meeting each week. Alfreda is top of the list there. Question or comment, or you just confessing about the root canal? Oh, here's a question about the peroxide. Where did you get your peroxide from? I asked my wife to get it. No, you can't ask her. That's just the way I did it. I'm sorry, I'm just kidding you, but I have no idea where she got it from. I think she went to one of the grocery stores. I think it was Whole Foods or somewhere. That was where she bought it. But she just came back. I said, get this, and she came back and got it. And when I made the mistake of leaving it in the bathroom instead of putting it back in the refrigerator, I got corrected on where it needs to be. So don't leave it out unless you want Joanna to get you straight. Okay, so someone said health food store. Okay, all right, good. So all right, that takes care of most of the questions that was in the chat. Alfreda, go ahead.
What was the question?
No, your hand was up. I was asking if you had a question or a comment. Was just your confession about the root canal?
Yeah, the root canal.
Okay, yeah, you were on the list. It was at least half of us, half of this group. By the way, it was about a year ago that I ran into a tooth that the dentist said needed to have a root canal. And I flat out turned it down and said no. I called Nkuzi first of all and said, this dentist says I need a root canal. He says, under no circumstance do you want to get a root canal. I said, but the dentist said, under no circumstance do you want to get a root canal. This is what the man said to me. So I listened to him. He's my doctor. So I didn't get the root canal. And then I went pursuing, the reasons for why I should not get the root canal. And Joanna reminded me of what Hippocrates said. Brian Clemens said at Hippocrates, okay, fine. So no root canal. But now, can we save the tooth? That was the next big question. So I told the dentist to, take out as much of the decay as they could and then put a crown on it. She looked at me like I was crazy, made me sign a release of liability that she was doing this procedure And she did not recommend it, and she would not be held responsible for the consequence of it. Listen to me carefully. I can chew on that side today, and I have no bleeding, no discomfort, no nothing on that side. So all I'm saying is it happened to me. I can't say that anybody else's situation is going to be better or worse or whatever, but no discomfort. Does that mean the tooth is dead? I don't know yet. I'm still going to check that out. But I have no problems whatsoever. So that's another one of the reasons why we're trying to get to the root of all this stuff. No pun intended. Rose White, you had a comment, or is that still your hand up from before? Go ahead, please. Don't forget to unmute yourself.
Yes, thank you. I have a question. First of all, how do you spell the peroxide? Food
Peroxide.
grade?
Food grade peroxide.
Food grade peroxide. I'm
Yes.
using that with the water pick, but I don't think it's the same peroxide that I'm using. It's the hydrogen.
Oh, hydrogen peroxide.
Hydrogen. Yeah.
Yeah. Find the real McCoy, you know.
Oh, okay.
Find the
All
real
right.
McCoy. Food grade peroxide. It's extremely potent, highly
Yeah.
toxic. You know, I held some in my mouth for a minute thinking I was going to kill the bacteria on my tongue, and it felt like my head was going to explode. I had to spit it out fast. I did not know that it would. Don't do that, by the way. Don't hold it in your mouth. Just let it run out. And by the way, it wasn't a lot. I mean, this was diluted. I'd only put like a capful in the water. I did not believe it would have that effect. So it is really powerful. So all it takes is like a dropper full, maybe two in the water. It looks like it does nothing, but it is that concentrated. All right. So just make sure
that's what I do. I put the cover of the bottle and fill it up, and then just drop it in the warm water in the water pick.
Okay, and that's the hydrogen peroxide, and you're only using a cap full of the
Right.
the lightweight stuff.
I have another question. I undergo an endoscopy this week, and they remove one.
You said one of your customers got COVID this week?
No, endoscopy.
You caught it.
Endoscopy. I had it.
Wait a minute. Am I the only one having trouble hearing Rose right now?
Oh, really? You are not hearing me? Okay.
You said an endoscopy?
Yes, that's it.
So
After endoscopy.
Okay.
And they remove one polyp in my stomach, and they find that I have mild redness on it. But the problem of burping and sometimes like discomfort, it's still there. The doctor recommended not to use NSAID like after the surgery. I don't know if microdaily is included as because of the anti-inflammatory ingredients in that. So what do you think? I'm asking.
Are you taking Immunorx, the colostrum, yet?
I do. I am still. I have
How
4 times already ordered.
How much are you taking?
1 teaspoon in the morning, 1 teaspoon in the evening before meals. I mean, half hour before meals.
Increase that.
Okay.
Instead of you said 1 teaspoon.
Yeah, the cup, the measuring cup.
Take that cup and throw it away.
Oh, so what do I do?
Get a tablespoon.
Tablespoon.
Yeah.
1 tablespoon.
1 or 2. Increase it until the problem resolves. Just keep increasing it until the problem resolves. You can't overdose. You can't overdo it. The maximum dose will just give you diarrhea.
Oh, okay.
But any burping and gastrointestinal problems you have will go away if you stick with the colostrum. Okay.
Okay. Yeah.
What about probiotics?
I do have probiotics. It's still 20 billion, 1 tablet in 3 times a day.
3 times a day? That should be fine. As long as you're
capsules.
getting 50 billion a day, you should be okay.
Oh, okay. How about the anti-inflammatory that they're talking about on my after the surgery? I mean the surgical procedure that I did. have.
Be careful. Your increase in the Immunorx will probably take care of the inflammation.
It will. Okay.
Yeah,
Okay.
probably. Okay, just be careful. That doesn't mean don't do it. If your doctor says it, remember I said don't do anything I say that your doctor said don't do. So, but go with what your doctor says. But colostrum will reduce inflammation anywhere in the gut area, anywhere in the gut area.
Oh, okay.
But you got to take enough of it. Take the right amount.
Okay. Thank you.
You're very welcome.
Got it.
Angelique Greer. The one that started this whole oral dental thing. Look what you did.
I know, but let me tell you what I did do. I did not get the food
And you notice I didn't tell them about the dancing Africans, but go ahead.
Okay, thank you. Okay, I did not get the food grade, but I've been using a water pick with.
You got the water pick?
And yes, I saw a difference right away. I usually have sinus infection.
Hold on, speak up. I need to make sure everybody can hear you, because I think if I'm having trouble hearing you, the others are not hearing you. Okay, maybe
I'm sorry. I am
Let's just make sure.
Somewhere where it's not quiet. But
turn around and tell those people to be quiet.
They won't. They're too far away. They're far away, but they're loud. But anyway, yes, I've already seen a difference. So I'm gonna get the food grade, but I still want to know about cavities. What about cavities?
Yeah, working on that. That's phase 2. That's phase 2, because I have been told by more than one expert that you can actually literally bring a decaying tooth. You can stop the decay, they claim that it is possible even to cause it to rebuild itself. So there are claims that can be the case. So I'm trying to make that a priority, but first things first, let's stop dying, stop the heart attacks, stop the cancer first, then we'll deal with the cosmetic stuff. So, but thank you, Angelique, for raising the question.
Okay, they stopped, the noise stopped. Okay, what I was gonna say is that, yes, I've already seen a difference. I was having a sinus infection, it went away. And just like you said.
So water pick, and you hadn't even been doing the food grade peroxide yet.
No, just the regular peroxide, because that's what I had at home. And there was a big difference in a matter of a day or two.
Yep. Very good, very good. Okay, there it is. I'm not the only one. So we're seeing a big difference here. Even Rose has had some positive results, and she's going to step it up to the food grade stuff. And again, remember, only about a dropper full. So that's really only like, if you take the cap off, it may be like a half a cap full, maybe a full cap full. Add that to the warm water. That's all it takes. It's really powerful stuff. And they've only been using the hydrogen peroxide. That's the little baby stuff. The food grade stuff is even more concentrated. Okay. All right. Very good. Daphne Miller, please.
Yes, I have a couple of questions and a comment. First, you can get the peroxide on Amazon. I see it, and they also have a stopper. They have the food grade. And I always have used peroxide, but I wouldn't swallow it. It was the regular peroxide. I'll swoosh it around and spit it out. And I go to the dentist regularly, but I've never had a problem with my teeth. But I'm gonna start the water pick.
Yeah, the water pick, you'll find that the water pick will stop. Bacteria loves anything that you leave in your mouth, anything that's left there. And you can floss from now to Armageddon and you're not going to get everything out from between your teeth. It's not going to happen. But that water pick, once you can handle it, you turn the pressure up, take the nozzle with the highest pressure nozzle. There's several different nozzles that they give you, but the one that's the highest volume pressure, once you get to the point where you can tolerate that, you turn that up, and then it'll blast all the food out of any pockets everywhere from between your teeth. I think it does a better job than flossing. Don't get me wrong, it's still flossed, but I think it does a phenomenal job with getting anything out that bacteria will feed on.
And with the mentholated micro daily, if you have a subscription, can you call in and switch over, or do you have to?
Just call in and switch it.
Okay. And I had a girlfriend I won't mention her name because people might know her, but she was taking the micro daily, the hydro, and she's feeling good and getting energy, and she have arthritis real bad. And she was feeling really good. Her arthritis was feeling better. And she did take it to the doctor, and the doctor told her to stop taking it.
Mm-hmm.
And I asked her why, and I told her I wouldn't listen to him. I'm sorry, I wouldn't. Because I said, you're feeling good. Now she don't stop taking it, and she's back where she was. But I asked her, why did he tell her that? He said, for her, she need to stop taking it. I said, well, you have similar to the same problems that my mother had, and she don't have a problem with taking it. I said, I don't know your history, but I need to know why. I would ask him why, specifically, why he said specific for me to stop taking it. So you can, then I can come back and tell you what he said, but she,
Yeah.
I don't know if she asked him yet, but I just was dumbfounded with that because she really was feeling good. I mean, Jonathan, when I said she was raving about it, but she don't stop taking it anyway. But anyway, and I think that's it. That's it.
I had a similar case. One of my, I call her my surrogate mother. Blood pressure out of control, put her on microdaily. She showed it to the doctor. Doctor told her to stop taking it. I still have the text message where she was raving about how much better her blood pressure was after taking it. But as soon as the doctor told her not to take it, she just brought me the bag back and handed it to me and said, doctor said, don't take it. And
Yeah.
and could not be reasoned with. And it's unfortunate. But I think some of the medical professionals, well, I shouldn't say this. I'm going to just put this right out there. This is my personal opinion, that there are some of them that their personal interest supersede their patient's interests. Sometimes
I
they
agree
have,
with you.
they have other interests, other reasons why.
Mhm.
By and large, I believe that the majority of them are genuine and sincere, and they are doing their best that they can, given the training that they're given. But and some of them are just uninformed. They just
Yeah.
don't know any better. They're afraid of anything that they don't know something about. So so that is, I like to say that most of them are just that way. They're simply uninformed. I like to just put the majority of them in that category.
And I'm sorry, I have one more question. Betsy wanted me to ask. She just been diagnosed with a rare blood disease, but I forgot what it was. I wrote it down and can't find the paper. But the hydro is doing excellent for her, but it has sugar in it, and whatever disease she have, the blood disease, it feed off the sugar. She wanted to know, could she increase the water for the hydro, and will that is that all right to do, to still take it with increasing the water?
Yes, she can. She can, but she might be better off just, instead of taking the hydro, just open up 2 capsules of the methylated, and that's equivalent to 1 pack of hydro.
Okay.
It just won't have the taste that hydro has. So, and she could just put that in a smaller bottle of water, but she could open up 2 capsules of methylated, and it'll be the same impact as hydro without the sweetener, and even better results.
And I'm not trying to take over, but one more question. I have a client who, when you said for the diabetes, I have 3 people want to get on the program of being a candidate for the study. Now, I did send them to the site, but I don't even see where to fill it out.
Click on start here. And then
Click on
three,
what?
start here.
Uh-huh.
And then 3 links will come up. And the one all the way on the right says research studies. And if you're
Okay.
looking,
I'm sorry, go ahead.
yeah, it'll say research studies, or anywhere on the menu item, it'll say research studies. And the only study that we're launching now is that one.
Okay. Okay, so when I give them the free bottle, how do I know you and Afrida had said once they take it, and if they continue to take it, fine, but if they say it's not doing any good for them, that they can get their money back, correct?
That's a different conversation, but yes. Yeah, there is a money back program. So we'll talk about that on the business meeting in a few minutes.
Okay, because I be done bought it and gave it to them anyway, so I was trying to figure out. Okay, all right.
Very good. Thank you. Excellent questions. James Peters, go ahead.
This is a testimony. I have been taking the brain boost because my memory was real bad. And I recently noticed I'm able to remember more. Like I've been watching your program on YouTube about a Metro Daily and cancer. I'm trying to remember the technology, the words that you use, and I'm actually can remember that, and that's been like last week, and I still can remember it. So I can see that is really working for me.
Wow, 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 wow. That's fantastic, James. Thank you for sharing that. So I'm gonna have to start taking. I haven't been taking the brain boost consistently because I keep forgetting. So I'm gonna have to start taking the brain boost more consistently. So thank you very much, James. I love it. Catherine Robinson,
Just
last
a
word
quick
on this.
testimony. It's about the gummies. I had my granddaughter placed on the gummies because my daughter felt like that would, help with her immune system going back to school. She started taking them, but prior to that, she was on pre and probiotics, had poor appetite, constant problems with her stomach. And even she said her attitude wasn't too good, and she put it toward the COVID situation. She said as soon as she started on the gummies, she took her off the probiotics and any other things she was taking. Totally different, hadn't complained. I think she's been only on it about a month. No complaints of stomach problems, increased appetite, and a better attitude.
Oh, wow.
So my daughter is swearing by gummies. I mean, she would even was craving, she's very thin, and she would crave a lot of carbs. That's what, bread. Now she was asking her, what are we going to eat? Food. So it's doing something because it's
absolutely.
Now, my
absolutely.
situation, right? Right. When Dr. Prasad mentioned about, because someone gave asked about how much should they take, and it had something to do with blood pressure and diabetes. My main thing was the blood pressure. It was going down, but not enough. The doctors always want to put you on more stuff. And I was determined. So when he said to take the 4 and the 3 and the 4, I started it. I did it 2 days before I had a doctor's appointment. And even that morning, I ate very little and I had that. They like that. I thought my blood pressure, because it was 3 weeks later, they wanted to check me because it went back up. The nurse asked me, "Are you feeling okay?" Because I'm thinking she's going to tell me it went up some more. And I said, "I feel fine. What are you talking about?" She said, "Your blood pressure had never been that low." And visit after visit, it had dropped to 110/60, and I hadn't seen that in years. When I started that regimen, and I have to watch myself because I noticed lately when I do that, I can almost tell that it's really dropping down. So I'm trying to make sure I eat enough and everything. So when they have these different dosages, sometimes that makes a massive difference. And in my case, I saw where I needed the 4 because of my age and my circumstance in the 3 and the 4, and I see a massive difference in everything. That's all.
That's outstanding. That's outstanding.
Especially my blood.
Thank you very much for
Mhm.
for sharing that story. We need to hear that.
Mhm.
And I think everybody's excited to hear that. So the
Okay.
434, is that the are you on the methylated formula or the original?
I'm on the EMF.
EMF. Okay, there we go. Let's be real specific. So yeah, that's increasing the dosage of the
Right.
EMF. So 434. Perfect. Yeah, wonderful.
Right.
Excellent, excellent, excellent. Good to hear. Thank you very much for sharing that. Okay,
You're
folks.
welcome. Bye-bye.
We're going to wrap it up right here, right now. Thank you very much again, everybody, for joining us. There's so many other things that you could have been doing on a Sunday afternoon, and we applaud you for taking time out to try to add to your knowledge base. You certainly add to mine each time we come together. I really appreciate that. And just for the record, my name is Jonathan Jones. It's been my pleasure and privilege to be the host and moderator for the program. This program has been recorded. It will be available on youtube.com/Jonathan Jones. I'm probably going to try to get it on up there today so that if you know someone that you think may have been able to benefit from something that was said here, just share it. I don't care where you share. You can share it all over social media, but push it out there. Let people hear that there are simple things that they can do that can have a positive impact on their life. Okay, so thank you all very much again for being here. We're going to follow up, do a little bit more discussion next week on oral health and how it impacts our overall immune function. We're going to spotlight a couple of the pathologies that are mentioned there in that book. So if you get the book, get into the WhatsApp chat. I will put a link there to download it. And you may not need it. You may have already Googled it. Half of you, I think, have already Googled it and found it and downloaded it while we were talking. So, but if you don't, I'll put it in the WhatsApp chat so you can forward that link to someone that you care about. Okay. So this will end us. We're going to, for those who want to stick around for the business meeting, we're going to have it was a 9-minute business meeting, but we've already gone into our time here by about 6 minutes. So it's going to be a 3.5-minute business meeting here in just a couple of minutes. So for everybody else that's been here for the first time, thank you very much for joining us. Bring a friend next week, someone that you care about. If you care about somebody, bring them next week. We'll be happy to help them to know what they can do to potentially improve their health and well-being. Thank you, everybody.